Welcome to our Restorative Yoga module. All the information that we will be using today comes from one of our books, Relax and Renew, A Restful Yoga for Stressful Times by Judith Hanson Lassiter. The Relax and Renew series that we're about to do begins with a gentle back bend and progresses into deeper ones. Next is an inversion or upside down pose, which reduces fatigue but is still somewhat stimulating on the scale of restorative poses. A twist follows to relieve any residual back tension from the back bending movements. The series concludes with supported forward bends, which are cooling and introspective, and will help you finish your practice in a quiet state, preparing you for basic relaxation pose at the end. This Relax and Renew series takes about 60 to 90 minutes, and it does not include setup, transition time for pose to pose, or staying longer in the pose. Just do what you can and always end with at least 5 minutes of basic relaxation pose. Take the time to familiarize yourself with the information that you will see in this video. Determine the props that you will need. Gather them into your practice space so they're close and you can move easily from one pose to the next. Always remember that these poses are for you and you need to feel comfortable in them. So, this is how this video will work. I'll show you the props and the setup of the prop, and then we'll go to the next photo and you'll see me in the posture, and I'll continue to talk to you about how the posture is set up and how long you need to be in the pose. Here is simple supported back bend. You'll need a bolster and a long rolled blanket. You could use an eye bag or a block or a blanket for extra warmth if you need to, and if you need a clock or a timer, make sure it's next to you. Many of us sit at work for much of the day with spine rounded and the arms forward of the torso, and as a result, tension accumulates in the muscles of the upper back. In response, most of us have the urge to stress our arms upward and bend backward. That is just what this pose helps us to do, but in a supported way. So, to begin, I want to tell you the cautions of who should not be practicing this pose. Do not practice this pose if you experience pain in your lower back in this pose. Do allow for the sensation of stretch, which might feel unusual, especially if you have been protecting your lower back. Do not practice this pose if you have spondylolisthesis, spondyliosis, or diagnosed disc disease. Do not practice this pose if you are more than 3 months pregnant. Practice the restorative series. Do not practice this pose during menstruation. Practice the restorative series, or just a basic relaxation pose. So to set up this pose, you want to begin on the floor in the front of the long side of your bolster, your knees bent and your feet resting on the floor, with a long rolled blanket by your side. Move slowly and with caution. If lying back causes discomfort in your lower back, begin by lying on your side over the bolster and then turning onto your back. And if you can lie back, place your elbows on the bolster, then use one hand to support your neck as you take your head back. Now lie over the bolster so that your mid-back is supported by it and your shoulders rest comfortably on the floor. Be careful not to put too much weight on your cervical spine. Place the long rolled blanket under your shoulders. If it's too high, unroll it until you are comfortable. This support helps to maintain the natural curve of the neck and allows your throat to open and relax. Keep your knees bent throughout the pose to protect your back and relax the abdomen. If you find it more comfortable, let the knees rest against each other. Rest your arms on the floor, either above your head or out to the side, whichever is more pleasant, and breathe naturally. Stay in the pose for about 30 seconds to determine how you feel. If you feel any discomfort in your lower back, slightly move off of the bolster in the direction of your head. If this fails to relieve it, slightly move off the bolster towards your feet or place your feet on a folded blanket. Make sure that your chest is open and your ribs lift away from the abdominal organs. So if nothing makes you feel good, roll carefully to one side and sit up. When you're in the posture and you feel comfortable, just start to breathe slowly and evenly. As you start to relax, you start to feel the beauty and the wholeness of the movement. We want to continue this breath and this back bend for about 1 minute, increasing your time in the pose. Simple supported back bend is an antidote to our habitual posture of rounding forward. The front of the body is energized, the abdominal organs are stimulated. The back bend will leave you feeling refreshed. Always remember, you need to feel good in the poses, and then you'll start to feel the effects. We stay here for 1 to 5 minutes. Supported bound angle pose. Here's the setup. We need a sticky mat, a bolster, 4 long rolled blankets, a double fold blanket, and a strap, or a sandbag if you have. Supported bound angle pose is one of the most important in the restorative series. So if it's the only pose you do all day, this is one of them. Physically, it opens the chest, the abdomen, and the pelvis. These areas are often restricted by the way we stand and sit, the shape of our chairs, and even the fit of our clothes. Psychologically, it allows for a deep opening with safety and support. As the chest opens, the arms and legs are cradled by the props. In the sutras, Patanjali writes about Hiranyagarbha, a Sanskrit word that means the great golden womb of the universe. Patanjali teaches that the entire universe is held within this golden womb. And as we practice supported bound angle, we are reminded of this primordial place of complete rest and ultimate protection. And while lying in this pose, you will experience some wonderful, profound, and calm feelings. One of the most relaxing of all restorative poses, supported bound angle requires some patience to set up, but it is well worth the effort. So let's talk about setup. Sit in front of the short end of the bolster with it touching your tailbone, and bend your knees and place your feet on the floor. Use your arms for support as you gently lie down. The bolster should support you from your sacrum to your head. If you feel any discomfort in your lower back, adjust the height of the support. You can increase the height of the bolster by adding a single folded blanket. You can decrease the height by practicing with a single fold blanket instead of a bolster. Once you're comfortable, place a double folded blanket under your neck and head. Make sure that your entire neck is adequately supported by the prop. Your head should not be too high or too low. Your forehead should be higher than your chin higher than your breastbone, and your breastbone higher than your pubic bone. Once positioned, your torso should be at a 45-degree angle to the floor. Place the soles of your feet together and let your knees fall to the side. Place a long rolled blanket under each outer thigh. Use the long rolled blanket even if you are supple and open easy in this direction. These blankets should completely support the weight of your legs so you experience no traction in the sacral ligaments, which are extremely vulnerable in this position. Make sure that the knees are at equal heights from the floor. Remember, the point of the pose is not to stretch the inner thighs, but to relax the abdomen and open the chest. And as you relax, your feet may slide away from you. A belt or a sandbag will hold your feet in position so your legs can relax. Fasten your belt into a loop long enough to accommodate the distance from your hips to your feet when lying down. Bring the belt over your head and position it around your hips with the soles of your feet together, and wrap the feet side of the loop around your feet. Be free and be careful to place the buckle where it will not press against your skin. The belt should not be tight. To help secure the belt once you lie down, position the loosened end pointed towards your hand. If you have a sandbag, you can use it instead of a belt. And I'll go over that setup, the belt, and how to loop it around your back and your hips and your feet. Start by placing the belt over your hips from behind, and then bring it inside towards the inner legs and loop the strap around the tops of the feet. Can you see how we brought the strap over the feet? And always remember to take that buckle and not place it on any of your skin, any part of the body. It should be not touching any part of you because it's kind of uncomfortable. But see how we looped it from the hip all the way to the tops of the feet? And then you could tighten it a little bit. It just helps support the hips down a little bit and keeps it open in a nice space. And we'll do this in class over and over again so you feel more comfortable with it. So here's the pose. I want to talk about some cautions about this posture as well. If you have any kind of disc disease in your lower back or chronic sacroiliac dysfunction, lower the height of the prop. You still want to keep your head much higher than your chest and your chest higher than your pelvis. If you have pinched nerve or disc disease in your neck, carefully support your head and your neck. Experiment with the height and position of your prop so that you can practice symptom-free. If you have a knee injury, bending it for long times can be uncomfortable. So practice this pose for short periods at first. Be sure to give adequate support to the outsides of your thigh to protect your knees. You might want to place blocks underneath the thighs. If you feel stiff after coming out of the pose and moving around for the first few minutes, practice for less the next time. Stiffness can come from overstretching the ligaments of your pelvis by practicing the pose for too long. And please do not practice this pose if you have spondylosis. Do not practice this pose if you experience discomfort in your neck, lower back, or knees, even after experimenting with prop height and placement. And here is an alternative arm position for our supported bound angle. It's a nice pose. It opens up underneath the armpits. It stretches out your shoulders, but it keeps it nice and relaxed at the same time, opening up the chest. You can try both of them. You'll enjoy both of them. Here's the setup for Mountain Brook pose. You'll need a bolster, 2 single folded blankets, and a long rolled blanket. And I used a rolled up mat. And so if you don't have enough blankets, you can use a mat or whatever you have, or a towel. In Mountain Brook pose, your body is gently draped in a wave-like pattern over the props, like water flowing over the stones in a mountain brook. While opening your chest, as in simple supported back bend, Mountain Brook pose adds 2 supports, one under your knees and the other behind your neck. With the help of the props, this pose allows for an opening in 3 areas we generally protect: the throat, the heart, and the belly. So let's talk about setup. You want to sit in front of the long side of the 2 stacked folded blankets. Lie over them to determine if the height and placement feel right. For most people, the center line of the blanket is best placed just below the shoulder blades. If you feel overarched, use only 1 single folded blanket or 1 standard fold blanket with a single fold blanket. As always, take the time necessary to find the right height of your prop. Now roll to one side and slowly sit up. And place the bolster underneath your knees and position the long rolled blanket to support your neck. Lie back with these 3 props in place. Again, scan your body to make sure you're comfortable. The arch of your neck should be completely supported. Your head tilts gently forward. Your throat is open and relaxed. The bolster under your knees protects your lower back. Your arms are placed out to the side at approximately 90 degrees, but whatever is comfortable is fine. If you feel any discomfort, please roll to one side and slowly sit up. Lower the height of the blankets to increase the height of the prop underneath your knees and lie back again. I cannot emphasize often enough that when the pose is properly set up, your neck should be completely relaxed. Close your eyes and place an eye bag over them. Let's look at the pose in its entirety. Mountain Brook pose counteracts the slumped sitting positions that so many of our daily activities reinforce. In addition, it opens the chest to help you breathe more fully. The pose also improves digestion, reduces fatigue, and can lift your mood if you feel down. But there are cautions. If you feel your back is too stretched or stiff after the first few times, try this the next time. Before coming out of the pose, bring your legs to your chest one at a time as you exhale, then roll to the side and sit up. Please do not practice this pose if you have disc disease, spondylosis, or if you are more than 3 months pregnant. So here's a little bit of a close-up of the first two props in the pose, underneath the neck and underneath the chest with the eye bag. So just make sure that you're comfortable in the pose. You don't have to use 2 blankets. Again, if it's too high, you could take 1 blanket out. You could roll the neck blanket in a place that you feel that's comfortable. Just always try to experiment in your poses. And here you'll see the setup for supported bridge pose. Here we have 2 bolsters, and on top of the bolsters we have blankets, and then we have a long rolled blanket. You could have an eye bag handy, a clock or a timer. If you get cold, if you're prone to get cold, get another blanket and you could place it on top of yourself. Let's talk about this pose and the setup first. An inverted pose, this is actually an inversion because our head is going to go off of the bolster. Supported bridge gives us an experience of what Iyengar calls negative brain. Here he does not mean negative as bad, but as cool, slow, and introspective. This restorative yoga pose is an antidote for living in an age that manipulates our brains and nervous systems into being hot, fast, and extroverted. So you want to place these bolsters end to end to accommodate the length of your body. The height of the props depend on the length of your torso and the flexibility of your upper back. If your back is stiff, you can begin by using single folded blankets and gradually increase the height. Most people find that props measuring 6 to 12 inches in height work well. If you are tall, try 2 bolsters with 2 or more single folded blankets on top to create additional height. Make sure that the height of the props is even throughout their length. You want to sit down, straddle the bolsters, and move slightly nearer to the end behind you. Use the support of your arms to help you lie down. Carefully slide off the end towards your head so your shoulders touch the floor and you face the ceiling. If you feel any discomfort in your lower back, bend your knees and place your feet either on top of the bolster or on the floor on either side. To preserve the natural curve of your neck, be careful not to jam your chin into your chest. To counteract this tendency, use a rolled towel to support the vertebrae, the C7 that's located at the base of your neck near the shoulders. Use a standard bath towel, the thinner the better. Fold the towel in half longwise and then fold one end over about 6 to 8 inches. Do not support the middle of the neck where the curve is the greatest. Experiment with the size of the roll so that you are comfortable. You can always reduce the size of the roll and let the unrolled part spread under your head. Place an eye bag over your forehead, on your eyes. Place your arms out to the side at a comfortable angle. And here we get to see the pose. The benefits of this pose of supported bridge pose, it drains the fluid from the legs after long periods of standing. It reduces fatigue. Athletes find it quite beneficial after long runs to help reduce soreness in the legs and hip muscles. This pose also helps alleviate headaches or mental agitation, which are often the symptoms of overwork. Cautions: this pose is not recommended for those who should avoid inversions. Individuals with hiatal hernias, eye pressure, retinal problems, heart problems, neck problems, and menstruating women. If you have any concern about practicing inverted poses, please consult your doctor. Do not practice this pose if you have spondylosis after the first 3 months of pregnancy, if you have a respiratory or sinus infection, if you have indigestion, if you are recovering from whiplash or have any questions about the stability of the pose for your neck. Here are the setup for elevated legs up the wall. It's another gentle inversion. We'll need a bolster and 2 single folded blankets I like to use a blanket underneath everything just to have some comfort and some padding. You can have an eye bag. You can also have a towel. Just keep extra props around you that you might want to use. Elevated legs up the wall is another gentle inversion, and the pelvis and torso are supported in a gentle back bend, while the wall supports the legs. With the help of gravity, the shape of this pose creates a waterfall as the fluid in the legs cascades down, pools in the lagoon created by the shape of the belly, and then spills over into the chest. Elevated legs on the wall is one of the most useful in this Relax and Renew series. It simultaneously revives the legs and relieves the back. Let's talk about setup. We want to place the long side of the bolster parallel to the wall, leaving about 6 to 10 inches between the wall and the bolster. Place a single folded blanket on the floor at 90 degrees to the middle of the long side of the bolster. Sit on one end of the bolster with the length of the bolster behind you and one shoulder near the wall. Roll back and simultaneously swing your legs up to the wall. This may take some practice to get right. People are usually too close or too far from the wall the first time. Don't be discouraged. Practice this a few times until you feel you can do it smoothly. If you still have trouble getting up, try the movement without the bolster so you can learn the proper relationship to the wall. Once in position, your legs are almost vertical and your torso is in a half dome shape. Remember, this is a relaxing pose, not a stretching one. You will not be able to relax if the backs of your legs are too stretched. In this case, you may need to readjust the props so that they are farther from the wall. Make sure your lower back is supported. The height of the props are also very, very individual. You will not enjoy this pose if the props are too high or too low. To preserve the natural curve of your neck, be careful not to jam your chin into your chest. To counteract this tendency, use a rolled towel to support the C7. Let your arms rest on the floor, either at your sides or overhead. If your arms are overhead, you can support them on another bolster or blanket. Place the eye bag over your eyes. Here's the pose as it should look like. For me, it might not look like this for you, but this is how I look like in the pose. It is a very beneficial pose that reduces the systemic effects of stress. It quiets the mind and refreshes the heart and lungs. It is especially beneficial for those who have varicose veins and for those who stand long periods of time, those who tend to retain water, or those whose legs swell easily. It's also a great posture for insomnia, and it also cleanses our lymphatic system. Please, this pose is not recommended for those who should avoid inversions. Again, individuals with hiatal hernias, eye pressure, retinal problems, heart problems, neck problems, and menstruating women. Some people find this pose difficult for their lower back, particularly in the beginning. If this occurs, bend your knees and place your feet on the wall or cross your ankles loosely and let the wall support your legs. This pose is recommended for those with mild hypertension currently being controlled with medication. In fact, it can help to lower blood pressure. But do not practice this pose if it creates pressure in your head, if you are menstruating, after the 3rd month of pregnancy, or if at risk for miscarriage. If you have spondylosis, if you have sinus infection, inverted poses can make this condition worse, including forcing the infection into the extusion tubes of the ear. However, if you have general stuffiness, this pose may help to clear your head. Reclining twist with a bolster. Here are what the props look like. And what you'll need is a bolster, a long blanket, and a couple of blankets on the top of the bolster if you like the height. At first glance, a twisting pose looks like we are tying ourselves up in knots. Doesn't life do that to us enough? In fact, reclining twist with a bolster is really a chance to untie the physical, emotional, and mental knots that we have been twisted into by living in this fast-paced world. In this pose, you sit on the floor with a bolster at your side as you twist towards the bolster. You lean on it until it supports your weight. Reclining twist with a bolster stretches the muscles of the entire back and makes a pleasant transition from the back bending of the previous pose to the forward bending of the pose that follows. You want to sit on the floor with your right hip close to the end of the bolster, and bend your knees and slide your feet to the left so the outside of your right leg rests on the floor. Your left leg can rest on your right leg, or you can open the space between them, whichever is more comfortable. Turn to your right and put your hands on the floor, one on either side of the bolster. Gently press your hands onto the floor and lengthen the front of your body. Then bend your elbows and lower yourself onto the bolster. Place your arms on the floor in a comfortable position. In this position, your upper back turns towards the right and your knees point in the opposite direction, giving a light twist to the vertebral column. To increase the twist, turn your head to the right, away from your knees. If this feels too much, either rest your forehead on the bolster or turn your head towards your knees. Here's reclining twist with a bolster with me on it. It relieves stress in the back muscles and those along the sides of the body. It also helps to stretch the intercostals. As all the muscles relax, breathing is enhanced. But this pose can be done by most people, even those with severe back problems. If you have spondylosis or disc disease or chronic sacroiliac problems, please proceed very carefully. Supported seated angle pose. This sitting pose is traditionally used to stretch the legs. And the props here are a bolster and 2 blankets. I recommend that even very flexible individuals practice this supported variation to enhance relaxation. You do not have to work aggressively to achieve the psychological benefits and the physiological benefits of this pose. We want to sit on the floor with your legs apart and the bolster between them. Do not position your legs so far apart that you are overstretching your inner knees. If you feel inner knee discomfort, bring your legs closer together until the discomfort subsides and you feel the stretch only in your inner thigh. Whether you feel discomfort in one inner knee or both, bring both legs in so each is the same distance from the midline of the body. If you can maintain the natural inward curve of your lumbar spine, located at the level of your waist, you can proceed. If your lower back rounds, sit on the corner of a single folded blanket. This will lift the pelvis and tip it forward to maintain the lumbar curve. Feel free to increase the height of your blanket so that you can lean forward without strain. Once comfortably seated, lean forward and rest your torso, arms, and head on the bolster. There are 3 possible positions for your arms and head. As always, experiment and select what feels best for you. You can fold your arms and rest your forehead and then turn your head to the one side. You can let your arms rest on the bolster, folded or separated, free from your head. Or you can rest your head on the bolster and let your arms rest on the floor alongside the bolster. Relax your neck and throat. Move your chin slightly towards your chest so that the back of your neck is long. Remember, the point of this pose is not to stretch but to open. As with all forward bends, supported seated angle pose can strain your lower back. Usually this is alleviated by sitting on a support high enough to tip the pelvis forward. For some people, however, the sacroiliac joint is still aggravated. Sacroiliac aggravation is experienced most often as a circle of pain about the size of a quarter or 50-cent piece over the left or right side of the sacrum. If you feel this pain in the pose, you may find relief by adjusting your body slightly asymmetrically to the bolster or chair. Twist your body slightly to one side and lean forward again. The benefits of this posture in general are forward bending benefits. They quiet the organs of digestion and elimination, such as the stomach, the intestines, and the liver. Women often find this pose especially pleasant during their menstrual cycle and throughout pregnancy. If you are pregnant, make sure there is room between the chair and your belly so that your baby are comfortable. In addition, this pose balances the squeezing effect on the spine and kidneys that backbending poses create. As a counterbalancing movement to the back bends, this pose opens the lower back area. Supported seated angle pose calms mental agitation and can be practiced to relieve headaches or insomnia. But take the most care to create comfort for your neck, lower back, and knees in this pose. If you experience discomfort in any of these areas after experimenting with prop height and placement, do not practice this pose. If you experience any neck pain or discomfort during or after this pose, make sure that the neck does not sag, but that you maintain the normal cervical curve, as you would when standing upright. If you experience pain or discomfort in one or both inner knees, bring your legs closer together. If you have disc disease in your lower back or chronic sacroiliac dysfunction, lower the height of your prop under your sitting bones and raise the height under your head and chest. You should not feel any sacroiliac pain or discomfort. If you do, try the adjustments. Supported cross-legged pose. This is another relaxing seated pose similar to the previous one, except that the legs are crossed at the ankles in a relaxed tailor position. The prop is a chair with blankets. In yoga, we are taught that the nervous system benefits from keeping the poses as symmetrical as possible. In supported cross-legged pose, we practice first with the right ankle on the top of the left ankle and then reverse the cross for an equal amount of time. In doing so, the hemispheres of the brain receive an equal amount of input from the nerves that interpret our spatial position. The brain translates this feedback as quietness. We want to sit on the floor with the chair in front of you. Take care that the chair does not slide. If it does, place it on a non-skid mat. Cross your legs at your ankles. If you can maintain the natural inward curve of your lumbar spine, located at the level of your waist, you can proceed. If your lower back rounds, sit on the corner of one or more single folded blankets. This will lift the pelvis and tip it forward to create the inward lumbar curve. If you know that you can bend forward easily, you can practice this pose with the chair seated facing you. If you do not bend forward easily, place one or more single folded blankets to raise the height of the seat, or turn the chair so the back faces you. These variations will allow you to come forward as you maintain the natural curves of the spine. Come forward, fold your arms, and rest them on the chair. Adjust the chair so that you actually lean on it. And if you bend forward easily, you might prefer having the chair farther from you. Whatever the distance, make sure that your lower back is lengthened. Now rest your forehead on your arms, or turn your head to one side. Your neck should not sag when you rest the forehead on the folded arms. If it does, it means that your chin is moving up and out. To correct this, draw your chin slightly back and in. You can also add more prop height underneath your forehead. Close your eyes and breathe. The benefits of supported cross-leg pose is similar to supported seated angle, offering additional benefits to the lower abdomen. In seated angle, the breath is felt more in the upper lungs. The breath moves differently in supported cross-leg, and awareness is brought to the lower abdomen. Since most of us hold tension in the belly, this pose helps to release below the level of the navel. In addition, this pose cools and relaxes the digestive and reproductive organs, kidneys, and liver. At no time should you feel any back discomfort or pain, and if you do, come out of the pose and raise the height of your prop. If this adjustment fails to relieve your discomfort, skip the pose for now. Do not practice this pose if you have diagnosed sacroiliac dysfunction, disc disease, or spondylosis. Basic relaxation pose with legs elevated. The last pose in our Relax and Renew series is basic relaxation pose with legs elevated. It's a variation of the basic pose to release tension in your lower back. Our props are 2 standard folded blankets or 2 or more single folded blankets and an eye bag. Remember, while basic relaxation pose is beneficial on its own, even deeper levels of relaxation are achieved if it's practiced at the conclusion of longer restorative series. So we want to set this posture up with these props. It's in basic pose. Before you lie down, position a standard folded blanket for your head and neck to rest on. In this variation, you also stack 2 or more single folded blankets to elevate your lower legs at least 10 to 12 inches to support their length. Begin by sitting on the floor and placing your lower legs in the stack of folded blankets. You can place a sandbag across your ankles to anchor your legs on the blankets. If you have a tendency to get cold, cover your legs with an unfolded blanket. Use the strength and support of your arms to help you lie back. Roll the long edge of your standard folded blanket slightly to support the gentle curve of your neck. Adjust the prop placement under your head and neck so you're comfortable. Your chin should be slightly lower than your forehead. This position quiets the frontal lobes of the brain, and if you're using an extra blanket for warmth, pull it up to cover your torso and arms. Cover your eyes with an eye bag. Rest your arms by the sides of your body. So, the benefits here is our lower back is especially vulnerable, and if you sit a lot or have weak abdominal muscles, practicing this variation of basic relaxation pose helps to relieve tension in your abdomen, as well as any tension in your lower back from the back bending restorative pose. The elevation of the legs reduces fatigue from standing or sitting for long periods of time. The only caution here is that if you're more than 2 or 3 months pregnant, I want you to practice side-lying relaxation pose. So here's a summary of the Relax and Renew series, and it's the time that I'm going to give you. The first pose we did was simple supported back bend. We want to hold that for 1 to 5 minutes. Then a supported bound angle pose, 10 to 15 minutes. Mountain Brook pose, 5 to 7 minutes. Supported bridge pose, 15 minutes. Elevated legs up the wall, 15 minutes. Reclining twist with the bolster, 3 minutes. Supported seated angle pose, 3 to 5 minutes. Supported cross-leg pose, 3 to 5 minutes. Basic relaxation pose with legs elevated, 5 to 20 minutes.